All right. Thank you, everyone. Welcome. And thank you for joining us this evening for our panel discussion. Hope that you're all staying cool during this incredibly hot heat wave. Uh, so today we'll be having the abortion care in California, current and future challenges and how we can help. I'm Maria Osorio, president of NCJW Greater Long Beach and West Orange County section. For those of you that do not know, NCJW is a national organization founded in 1883. It's nearly 140 years old. We are the oldest Jewish women's grassroots organization in the country and are continually guided by Jewish values that call on us to improve the lives of the most vulnerable women, children, and families. We are a volunteer organization inspired by the Jewish values of Tikkun Olam, meaning repairing the world. We take progressive and visible stance on issues, including immigration, refugees, human trafficking, women's rights, reproductive freedom, and voter engagement and education. Via our advocacy work, we create alliances, work in partnership, and provide leadership and education on issues such as reproductive health and rights, voter engagement and education, women's rights, economic and racial justice, human trafficking, immigration, and refugees and homelessness. Via our community service work, our volunteers provide hug packs with school supplies, personal care items for foster youth, nutrition for insecure college students, in-kind donations for residents of women's shelters, as well as families and community members experiencing homelessness, and assist at and provide backpacks for Long Beach Unified School District kindergarten festivals. Thank you to our two vice presidents of legislation and advocacy who were instrumental in organizing this event, Cynthia Gordon and Deb Relchek. Thank you also to Sherry Sobel, who will be moderating today's discussion. And most importantly, to our four panelists who will be introduced in a moment. Given the recent Supreme Court decision regarding our bodies, we felt this was a necessary discussion. I'm sure it will be informative and lively, full of all kinds of questions at the end. So once again, thank you for joining and enjoy the evening.
Thank you, Maria. As she indicated, I'm Cynthia Gordon. I'm the co-vice president for advocacy for our section in Greater Long Beach and West Orange County. And I'm really happy to welcome all of you to our program tonight on abortion care in California, current and future challenges, and perhaps really most important, how we can help. We'd like to come out of this evening with some ideas for an action plan. We're all feeling strong emotions, to say the least, in response to the recent Supreme Court decision to overturn Roe and almost 50 years of abortion rights in this country. For that reason, we planned a program that will not only inform, but as I said, will also give us ideas for activities that we can start afterward. Our speakers will update us on legislative action in California, current and future access to reproductive health care services, both for in-state and out-of-state patients who are coming to California, and how abortion funding is being managed for those needing care. So I'd like to talk about a few housekeeping items. You're all muted, and we ask that you remain on mute for this evening's discussion. We will not be taking oral questions, but we will take questions through the chat. So if you have a question for one of our speakers, please write it in the chat, and we'll try to get to as many of those questions as possible after all our speakers have finished. I encourage all of you to remain in speaker view to best see our speakers as they are individually highlighted as they speak during the program. Closed captioning is also available to you if you want. You can turn it on by clicking at the bottom of your main Zoom window. There's a little, it says CC, a little button that says CC, which I've just enabled. And I also wanted to note that we are recording this discussion, and we will be posting it to our website and also to our YouTube channel. And now it gives me great pleasure to introduce Sherry Sobel, with whom I've been working at NCJW for a number of years, who is an active NCJW member on our advocacy committee and has contributed many, many ideas and actions, as well as being a member of NCJW's federal bench group. So Sherry will go ahead and introduce our dynamic speakers for this evening and moderate our discussion. Take it away, Sherry.
Thank you. Hi, everybody. So glad to see you all. We have four absolutely fabulous speakers tonight. I'm not real big on bios. I have them. I'll give them to you. You can assume that these are four of the most incredibly dynamic women that you will ever see speak. Alaska, Kansas, New Mexico, this country is coming alive all of a sudden. I'm sick and tired of saying that the next election is the most important one of my life, but that's the way it is, and that's the way it's going to continue. So here, without further ado, are the four fabulous women who are going to be speaking tonight in their order. Sylvia Gazarian, Executive Director of the Women's Reproductive Rights Assistance Project, WRAP, and is a council member for the California Future of Abortion Council. In her role, she leads the 31-year-old organization and its incredible volunteers and board. Sylvia has over 30 years of professional nonprofit and for-profit experience, fundraising, finance, operations, and has received 23 national awards. She was appointed by the mayor to chair the Commission on the Status of Women for over 12 years, including now. Some policies that Sylvia has implemented locally include ratifying the Convention on the Elimination of All Forms of Discrimination Against Women. Oh yeah, there is an acronym, CEDAW, an international human rights treaty that condemns all forms of discrimination, retaliation, and violence against women and girls. Ms. Gazarian also actively mentors women and girls and has mentored over 10 young girls from vulnerable communities in recent years. Krista Hollinger started with Planned Parenthood, left and did fabulous things, and came back to Planned Parenthood. And apparently, according to John Dunn, the president, they couldn't be more tickled. She's the new chief operating officer, and she will oversee the second largest Planned Parenthood affiliate in the nation. My God, is that exciting. Covering 9 health centers, spanning Orange and San Bernardino counties with comprehensive reproductive care and primary services. Krista brings a rare combination of great passion for our mission and a deep knowledge of our local healthcare system. Her work and leadership roles at 2 of the best hospitals in the area has prepared her well for this role. She has 20 years experience working in health administration and public policy with extensive expertise in reproductive healthcare management. She was Chief Administrative Officer for OB/GYN at the University of California, Irvine School of Medicine. Hi, Debbie. During Hollinger's tenure, the gynecology department has been the highest ranked program at UCI for the past 4 years and has also been named Best Maternity Care Hospital by Newsweek for the past 2 years. Okay, let me grab Aisha. Aisha Wagner, MD, founder and co-chief medical officer of Choice. I think that's it. I thought that's what she said. CHOIX. I just love it. Fellow Physicians for Reproductive Health. As one of the founding clinicians of the company, Aisha brought years of clinical experience to the development of Choice's platform, collaborating with the co-founders to develop our patient care protocols. And in her role as CMO, continues to collaborate on Choice's vision for future healthcare services. She did, after medical school and residency, she did a fellowship in reproductive health and advocacy in New York, as well as a fellowship with Physicians for Reproductive Health. She's created and collaborated on reproductive health, reproductive rights, and reproductive justice advocacy projects, taught women's health procedures, including abortion, to medical students, residents, nurse practitioners. She has spoken as an expert on contraception and abortion care with media, state representatives on panels, and as an invited grand rounds speaker. She also practices family medicine in LA, providing in-person abortion and contraceptive care, as well as full spectrum, patient-centered primary care in multiple clinical settings. You people can start getting an idea of who, in fact, we are meeting tonight. Dr. Tabitha Harkin, otherwise known as our Tabby, did a whole bunch of school stuff, years and years and years and years of school stuff. Following fellowship, she was recruited to University of California, Irvine, UCI, to expand reproductive health services within the Department of OBGYN. She founded the UCI Women's Options Center, providing much needed contraception and abortion services for medically high-risk patients. She started training the OB/GYN residents in family planning, remains the director of the UCI Ryan Residency Training Program in abortion and contraception, started in 2009 to the present. She founded the UCI Division of Family Planning, which has become a referral center for high-risk family planning patients for all of Orange and San Bernardino counties. She provides direct clinical care, has repeatedly been named, oh, Tabby, a physician of excellence by the Orange Coast magazine and by the Orange County.
I think we need to be honest here. I'm getting special treatment because I'm friends with her daughter.
I'm reading it right off the paper.
That's true, but
In her leadership
I can
position
vouch how fabulous you are.
oh, thank you.
as the division director of family planning, she mentors students, residents, and junior faculty in the Department of OBGYN. Fluent in Spanish, she can translate in clinical settings. She speaks passable French with her in-laws who don't speak any English. She has 9-year-old twins, who I remember, 2 guinea pigs, and 1 rescue dog. Ladies, what a pleasure to read all of that out, and what a pleasure to know you all. Take it away. We're going to start with Sylvia. Sylvia, go for it.
Wow. Thank you so much for the wonderful introduction and for having me this evening. It's so great to be here with the NCJW Greater Long Beach and West Orange County community, knowing that RAP started at NCJW LA prior to branching out. It's also great to be a part of this panel since we also provide abortion funding for Planned Parenthoods across the US, as well as Choice, and to have a chance to meet Tabitha yesterday as well. I'm sure our connections will continue on after this conversation. I want to start by saying that as heavy and painful as this moment is for reproductive justice, we are not giving up, we are not hopeless, and we are in this to help one another. And those in this movement have been planning for years for this, knowing that our system has never been just, even with Roe v. Wade. My hope is that we can inspire you to continue to fight with us. Before diving into the current situation, I want to take a second to talk about the history of RAP. RAP, the Women's Reproductive, published in 1991 and headquartered in Los Angeles, is the only independent 501c3 abortion fund that provides urgently needed financial assistance on a national level to those seeking abortion or emergency contraception. Now in its 31st year, RAP was started by founder and president Joyce Shore, who is still actively involved in our mission to ensure that financially needy individuals of all ages, ethnicities, cultural backgrounds, gender identities, and sexual orientations can access safe abortion and emergency contraception funding. Joyce started this organization because her best friend in college had to have an illegal abortion. It is because of Joyce's experience and vision that RAP was built for this moment, to be able to provide abortion funding in states from coast to coast. With the Supreme Court overturning Roe v. Wade, the landmark 1973 decision that confirmed the constitutional right to abortion, reproductive justice leaders like us have already been contending with a post-Roe America for years now and preparing. We knew that 26 states would move quickly to ban abortion, causing severe health, financial, mental, and emotional consequences for people, especially those in marginalized communities. We see it every day. Of these 26 states, 11 laws in place are designated as trigger and take effect automatically or quickly by state action to ban abortions. The following states now banned abortions, and they're shown on one of the slides that I have here. And they are Alabama, Arkansas, Idaho, Kentucky, Louisiana, Mississippi, Missouri, South Dakota, Oklahoma, Tennessee, Texas. And these are all states, just so people know, that are hostile to reproductive freedom and justice and have been for a very long time. And this map is continually changing each day based on what's happening legislatively on a state by state basis. As we all know, a state's abortion policies affect all people seeking care, but bans and restrictions have significant challenges for people already facing barriers due to factors like their race, income, age, or gender identity. RAP follows a reproductive justice model, which is a very specific framework and theory founded in 1994 by a group of 12 Black and African American people. And it encompasses the right to have children, the right to not have children, and the right to parent and care for our families with safety and dignity. With that said, we work exclusively with a caring and compassionate network of over 700 clinics, doctors, and hospitals that have been vetted to provide the funding necessary for people to receive abortion care. The good news is that we also know that 16 states have enacted policies to protect abortion rights, shore up access to abortion care, and repeal existing restrictions. Most of these states are California, Colorado, Connecticut, Delaware, Illinois, Maine, Massachusetts, Maryland, New Hampshire, New Jersey, New York, Oregon, and Washington. These are states we already work with and ones that we continue to depend on now. The measures that these states are taking will not only expand access for their residents, but will support people from other states who might be forced to travel long distances because of restrictions or bans in their home state. And some of these states are implementing legislation to protect anyone who helps someone have an abortion in another state by prohibiting courts from taking up any cases based on out-of-state laws that criminalize abortion. The criminalization of people of color and Black people in particular is the foundation upon which the right hopes to control people's reproductive outcomes. Specific to California, now a sanctuary state for abortion care, there's also now an amendment to the state constitution explicitly guaranteeing the right to abortion and contraception. Proposition 1, which is on the November 8 ballot, ensures further protection against future attempts at the federal level to restrict or ban abortion access, and from any state actions that may interfere with this right in the future. Know that California has long been a leader in the fight for sexual and reproductive health care, reproductive autonomy, and basic human rights. Also know that California and Vermont are the first states to ask voters to put such an amendment in their constitutions. And we all saw how in Kansas, an amendment to prevent the Constitution from protecting abortion rights was resoundingly defeated in a special election in August. In addition, in California, through the work of the California Future of Abortion Council, which I am a part of, we put forth last year 45 recommendations to Governor Newsom, of which 13 are now sitting on his desk awaiting his signature. This is the largest and most comprehensive abortion protection and expansion bill package in the country and comes with a historic budget investment of $200+ million. Because of time, rather than highlighting each bill sitting on his desk, I'm going to forward a blueprint of these bills to you. Right now, California uses tax dollars to pay for abortions of people on its Medicaid program, requires private insurance companies to cover the procedures without charging a copay or a deductible, and allows minors to get abortions without their parents' permission. However, we also know and fund those who may not have coverage: undocumented workers, minors, military and federal employees, and the growing number of patients now traveling to California for abortion care. For RAP, we're really scaled up to meet as many different scenarios of need and continue to do so. Because we are national and fund in states from coast to coast, we work in under-resourced communities and abortion deserts daily to gauge what is needed and what we can do to meet the demands. We know that pregnancy and reproductive health care are particularly dangerous for Black women. This shows up in our work every day, and we see the barriers that people are facing in pregnancy, unwanted pregnancy, and the ability to travel for any care. Recognizing many can't travel for care and the many abortion deserts that exist throughout the US, including here in California, RAP has created funding specific for the abortion pill by mail. Since the FDA late last year finally lifted in-person dispensing requirements for medication abortion pills, it was a critical step toward expanding access to this safe and effective method. RAP now is working with a number of providers to fund the abortion pill by mail. We've always funded medical abortion at clinics and know that the majority of pregnant people seeking abortion care are in their first trimester, many of whom cannot afford to travel, and travel these days is over 100 miles. By expanding access to fund individuals who can utilize this service and have the pills delivered to their homes, we're helping to lift a barrier to care as well as cost. We also continue working with virtual clinics, which we started when COVID required people to stay at home. This again was a proactive step we implemented immediately to be able to continue to provide abortion care for people. The other thing I want to mention that many may not realize is that too many funders, including corporations, have shied away from protecting abortion as a fundamental human right. And some of the biggest backers don't like to talk about it. Know that less than 3%, yes, less than 3% of funding for abortions is designated to direct services and RAP. As a national independent abortion fund, we can't wait for funders to provide abortion care, and nor should it be delayed. It's just a reality that we fundraise every day to make sure that we take care of patients. I bring this up because it creates a huge barrier in the amount of funding we can distribute. And as we gear up to provide a larger add to abortion costs, we are in a constant fundraising mode to keep ahead of the demand. I just had a case recently of a patient, 19 years old, with fetal anomalies. Her procedure cost $7,000 and she had to travel from Kentucky to another clinic on the East Coast. RAP was able to provide funding and are grateful to be able to do so. To give you an idea of costs, abortions that used to cost $500 now cost $1,500, for example. And our abortion pill by mail program ranges anywhere from $150 to $450. This year, we are close to 200K above where we were last year at this time for funding. And the number of calls we receive has grown exponentially since the fall of Roe and the total ban in a number of states. We know that these numbers are expected to continue to climb. You'll see from my slide that in last year's stats, we funded close to 550K and are forecasting going over 1 million plus in funding needs this year based on the world post-Roe. In addition, I need to mention that talking about abortions, saying abortion, and making it common will help destigmatize this common and safe health procedure. There are people here today that have had abortions, and if you are comfortable, sharing our stories only help to strengthen our power and our voices. The reality is that this is a public health issue that reduces maternal mortality, which we know the US has the highest rate of maternal mortality more than any other developed country. No one should be forced or controlled to carry an unwanted pregnancy that has detrimental effects not only on the person's physical and mental health, but on the unwanted child. And to add now that rape, incest, and domestic violence, and even the life of the person are no longer considered exceptions and criminalizing abortions, these are all forms of violence against people. To give you a little bit of an idea of our demographics, when we look at demographic data of our fund, we know that the typical patient is already a parent with 1 to 2 children, 74% or more, is a person in their late 20s or early 30s, and has attended some college, is low income, is unmarried, and has had their partner abandon them. 83% have had their partner abandon them, leaving the financial responsibility of an abortion up to them. Many are in their first trimester and have not had a previous abortion, and close to 73% are BIPOC. Know too that last year 24% had to travel, and this year, based on our stats through July, this has increased to 35%. Everyone, no matter their age or how much money they have, should be able to get timely and affordable abortion care, period. Across the country, abortion is not uncommon in the reproductive lives of women and transgender and non-binary people who can become pregnant. Another important aspect to understand about RAP is how we work. RAP has only one paid employee, that's me. We have 10 dedicated volunteers who have been with us for years that run our 24/7 hotline. Each day, our volunteers handle calls from our hotline and call back clinics and doctors that same day to make pledge commitments for patients. Our model is different from other abortion funds. We work directly with clinics, doctors, and hospitals. What makes our fund unique is that we fund in states across the US. Many of our sister abortion funds can only fund in their state or county, and many unfortunately are small and run out of money weekly and monthly, and or have had to shut down for now because of bans in their state. We step in to help them and also provide what's called solidarity funding for cases where costs are over $10,000 and above. And let me tell you, those cases have risen tremendously for us. I also want to share ways today that the NCJW community can help us. As I mentioned, one of the biggest challenges RAP faces is being able to fund at higher levels of giving. This is where you can be most helpful in sharing our collective passion on this issue and, where possible, raise funds for us. As waiting periods increase and there are delays at clinics for appointments, the cost of abortion care increases. Our primary goal is to secure as much funding as possible to be prepared for what may happen in the weeks and months ahead, and also help us fund new programs like our advanced provision for the abortion pill by mail. And while we are hopeful about a positive outcome from the midterm elections, it will take quite some time to fix any and all of the damage that has happened so far, which is why we are counting on you still. We also ask that each of you reach out to let people know we are here to help fund abortions and work in each state. Please also continue to educate and talk about abortion. This past year, we held what were called Courageous Conversations about Abortion through a collaborative fundraiser with NCJW LA. You can do the same, and NCJW has templates on how to get started in doing this to be a part of this fundraising effort. And finally, do everything you can to get people to vote. Empowering everyone to participate in our democracy and protect our freedom to vote is something we can each do. I know when I say voting and your voice matters to all of you, you get it. and you recognize voting for advocates and legislation for reproductive freedom and justice is critical as we move forward. Very, very critical.
Thank you very much. Thank you. That was really great. Thank you so much, Sylvia.
Okay.
And I think at this point, we'll move on to Christy. All questions will go in the chat for the end of the thing. Thank you so much. That was just wonderful.
Thank you.
Krista, take it away, honey.
Okay, sorry, I had this up and now it's of course messing with me just as I'm coming online here. Here we go. Okay, so good evening, everyone. You can hear me okay? Good. So I want to thank Cynthia, Sherry, and the council for inviting me to be with you all this evening. I'm going to reiterate some of the points that Sylvia was just making as well, but I don't think you can hear this stuff too many times. So as was mentioned, I am the Chief Operating Officer at the local Planned Parenthood affiliate. I'm sure everyone on here knows what Planned Parenthood does and is all about, but I'll just take a couple seconds here to tell you about our affiliate specifically. We have 6 health centers in Orange County and 3 in San Bernardino County, and we're actually opening up our 10th health center here in the city of Fontana early next year. Last year, we provided more than 230,000 visits, which is the second highest volume in the country. And we attribute that in large part to the fact that we are the only affiliate in the country to be open at all of our sites 7 days a week. So we are open 7 days for 10 to 12 hours a day. We also staff an online program 7 days a week through which patients can get prescriptions filled for birth control, emergency contraception, and treatment for urinary tract infections. We provide a range of services, including abortions, STI screening and treatment, birth control, including vasectomy. And I always like to say that because people like to hear about that part of our program as well. Well woman exams, and then our affiliate also provides primary care. Again, one of, I think, the only ones in the country to do so. And just this past year, we were really excited to incorporate behavioral health services into our services. And then, of course, we educate young people and actually people of all ages with comprehensive reproductive health education and decision-making skills. That's a real integral part of our mission. So this has been a tough few months, as Sylvia was talking about as well. We really are at the most frightening point in the reproductive justice movement that we've been in for the last 50 years. We're already starting to see the devastating impact of a constitutional protection to abortion going away. And then we don't know just how bad this will actually get. There's a lot of ideas out there about how bad it could get. And unfortunately, and sometimes you think it could just be hyperbole, but unfortunately, we're starting to see that, oh no, there are some pretty drastic draconian measures that are coming across in many states, not just 1 or 2. And in the 2 months since the Dobbs decision, the legal landscape across the country, it's been evolving very quickly and it's complicated. I like to say that our general counsel, we have a fabulous one, thankfully, at our affiliate, is just playing whack-a-mole all the time. And we just saw a really helpful graphic on the states. There are 17 states we still anticipate that it will be about 26 states who will have some form of an abortion ban. Currently, there are 17 states, 11 of those are total bans. 3 are bans at 6 weeks, which is essentially a total ban. And of course, we know that this leaves millions of women, tens of millions of women, mostly women with lower income and women of color, without options for care and really unable to control their own bodies. So that's the bad. But out of darkness, there is light too. At our staff meetings, I keep reminding our team what Mr. Rogers said: when you see scary things in the world, look for the helpers. And at PPOSBC, we have a team of helpers that are dedicated to making sure women across the country have access to safe, compassionate abortion care. So a year ago, when Texas passed SB 8, which was essentially banning abortion in that state for all intents and purposes, and then followed by the hearings in the Dobbs case in front of the Supreme Court, the writing really was on the wall for all of us that provide abortion care. And so our affiliate started to get ready, got to work to respond to the impending access crisis. We formed the Abortion Aid Program to help patients traveling from other states to our affiliate. The program is a multi-departmental effort. It's across our entire organization. And through it, we assist women make appointments, coordinate travel arrangements, and we also provide financial assistance for travel costs, including for air, hotel, and gas assistance. So to prepare for the influx of patients over the past 8 months, as we've developed the Abortion Aid Program, we've made some operational changes to double our appointment spots for abortion. We hired staff, which is not that easy to do in today's healthcare market, but we have been trying to stay above water with that. We've hired a dedicated patient navigator who provides personalized assistance to women to assist them travel here. Set up contracts. We have 2 hotels in each of our 2 counties so that they bill us directly. That way the patient doesn't have to pay and then get reimbursed by us. It's just a direct contract that we have with the hotels. And then we purchase gift cards for gas and food. We created a website specifically for the Abortion Aid Program, and it basically directs patients to our call center, which is our general call center for all patients in California as well. And that allows them to make an appointment at any of our 9 health centers. And then if they need travel assistance, they're referred to the dedicated patient navigation team. And we do have someone who is on call over the weekends as well to help with those travel arrangements. So on June 24th, when the Dobbs decision was released, we had 4 women call us from Arizona that Friday afternoon, scared and confused because they all had appointments for abortion either that day or the next day, and they were suddenly canceled. One woman called and she was crying. She told us, "I don't understand what is going on, but I'm at a Planned Parenthood in Arizona right now. I'm scheduled to have my abortion today, and someone just came out into the waiting room and told me that I can't have my abortion because some people made a decision saying it wasn't legal anymore." You know, they didn't understand what was going on. And that was a really difficult day. I was on conference calls with physicians from across the country, many of whom were crying, who were having that same experience that that patient that I was just telling you about had. You know, where their administrators were coming in and saying, "Okay, this is your last patient, or you need to stop for the day." You know, and we're going to hear from 2 fabulous physicians who have dedicated their professional lives and their personal lives to helping women, and to be cut off like that is it's just appalling. So June 24th was a very difficult day for us, even though we knew it was coming. We've known it for years. We've seen the restrictions on access to abortion happening, them chipping away at it. Then of course we had a pretty good idea when we saw the hearings and we saw the Supreme Court appointments that happened over the last few years. Then we had an even better idea in, I think it was March or April when it was leaked. So we knew it was coming, but it was still really hard. But our helpers are present. So all 4 of those women, you know, that happened to call that specific day, who were sort of lost and confused about what was going on, we got those women in that weekend. And in fact, in the past year, since the Texas ban went into effect, which was about 12 months ago, we provided abortion care to 275 women who have traveled to us from outside of California. Prior to last year, we were seeing about 4 women a month who lived out of state. And then it increased to an average of 18 a month, half of whom were from Texas. Back in September, it increased. And then since the Dobbs decision on June 24th, 109 women have come to us from out of state. So just in the past 6 or 7 weeks, or no, that would be 8 weeks, we've had about 109 women. And, you know, every time I see that number, I remember that those numbers are people. You know, it's the woman who drove to us from Texas, staying overnight in her car at a rest stop. It's the woman whose nausea was so terrible that her family had to keep stopping the car as she traveled here from Texas. And she actually was slightly late to her appointment because they had to keep stopping, which of course, you know, we accommodated her. That was no problem. There's the woman from Arizona who had a young child at home and a job. And she just had this window on a Saturday to come to us. And she was frantic because she didn't have childcare for very long. And so our staff actually spent a couple hours working with her and trying to find the airline tickets for her that would get her to an airport that was near us and in that window so that she could come and have her abortion and return home to her child and her job. So I'm so grateful and proud that PPOSBC is here for these women. But it's absurd, it's appalling, it's every negative adjective that I can think of every day, that women in this country have to wake up and have to deal with this to access healthcare, because abortion is healthcare. It's a basic healthcare service, and the fact that women have to have those experiences, and those are just a handful that I shared with you. Those are real life stories of our patients. That they have to have that is just atrocious. Another negative word to describe what's going on. So since the abortion aid program was formed, we've spent about $7,500 on travel assistance. So that's just since March. And then we have underwritten the cost of care for the 275 women who have come to us seeking abortion from out of state. So again, that's kind of the bad. That's a little bit of the good, I hope, in terms of what we've been able to do to respond to this crisis. But there's more that all of you and your friends that are outraged like we are can do. So just a couple ideas. The most important thing is to vote. We need to help keep California a reproductive freedom state by ensuring we elect officials at all levels of government that support access to reproductive health care, including abortion. And I say all levels of government because, as you know, even just like the city of San Clemente was trying to pull some ridiculous stunts to try and prevent there ever being an abortion provider in their city. So it is truly all levels of government that we need to be focused on. And, you know, our status is a reproductive freedom state, and we are one in California, thank goodness. But that didn't happen by accident. There have been advocates who have been working very long and hard to get us to this point for decades. And we need to maintain it here in California. As we heard, there is a proposition on the ballot this November. And so it's really important that we get out and we vote for that in really, really strong numbers to send a message, just as Kansas sent a message, thankfully, a couple of months ago. And we also need to support candidates in other states so we can build a larger coalition of reproductive freedom states across the country. Unfortunately, we know that there are just some states that are, as we saw on that map, that are going to be restrictive. They're always going to have some level of restriction, but we need to minimize the number of states that have that and maximize the number of states that have a protective reproductive freedom stance. The second thing is our fabulous public affairs department. Sorry, I had a little message on here. Can everyone hear me okay?
Yes.
Okay, little message said to unmute yourself. I'm thinking, oh my gosh, have I just been talking to a room full of people who can't hear me? Anyway, so our public affairs department has developed this wonderful advocacy toolkit. And when I'm done speaking, I'm going to just drop the link to it in the chat so you all can have that. We can also email it out if you need it. But there's all sorts of information in there about how you can get involved. Some tips for writing postcards, having postcard parties, having house parties at your home. I have a few friends that are doing that, and then I'm coming and speaking to their friends. And then we have a virtual event coming up on September 20th at noon. So that's in 2 weeks, We're going to have political strategist Celinda Lake talking to us about the midterm elections and trends she is seeing, especially in light of the Dobbs decision. So I will drop the link to that event in the chat as well in just a moment. And then, of course, for any who want to help financially, I would be remiss if I didn't say that, yes, there is always an opportunity to do so. As I said, we have incurred the cost of travel and the cost of care at Planned Parenthood, and will continue to do so. And every dollar that we're able to have donated to us really helps with that. So at our last abortion aid work group with the team, we reviewed our progress in the first 6 months. And I asked the team to describe in one word how they feel about our journey this far. And I want to just share the list of the one words, because I think it's a really powerful description of how the affiliate is meeting this moment and how I think really advocates across the country are doing so. So this is what the team shared: dedicated, innovative, powerful, proud, resilient, supportive, access, responsive, compassionate. And I say compassionate squared because there were 2 people who said that. And then my favorite, someone said heart. So thank you again for including me this evening. I look forward to joining with you with compassion and empathy and heart as we fight this battle for reproductive justice and the protection of really basic human rights across the United States.
Thank you so much, Krista. That was absolutely wonderful. And welcome back. We're so glad to have you back.
Thank
We'll
you.
be seeing you soon, I'm pretty
So
sure.
happy to be back. I hope so.
Dr. Harker, take it away.
Thank you so much. And it was so wonderful to hear Krista talk and hear Sylvia talk. So I'm going to sort of change the direction of this just a little bit and just talk about my vantage point, which is really hospital-based and education-based. So I work at the University of California, Irvine. It's a tertiary care center. And whereas the other people are really able to take care of many, many, many people, my division takes care of the sick patients. So the patients who are too sick to get services at Planned Parenthood. And I work at Planned Parenthood as well. It's the part of my job that keeps me sane because we just provide services and everybody's supportive. And then I go and fight the fight when I'm at UCI. But recently with Dobbs, there has been a big explosion of interest in women's reproductive health and reproductive choice and rights across the board at UCI, which is really encouraging. And we have taken a bunch of steps. We're going to start doing a lot of education initiatives. And so one of the big questions is, now that all of these states, 11 to 26 states are banning abortion, who's going to know how to take care of these patients when a patient comes in with an abortion complication if they've never been trained in abortion care? So one of the things Krista didn't mention, but I'm very, very proud of, is that Planned Parenthood is now hosting a lot of residents, I think from 11 different programs. How many programs is it now across the states, Krista, that to train those OBGYN residents?
Yeah, so all the Planned Parenthoods in California, I think, are participating at different levels. I know that we've got 3 at our affiliate. Mm-hmm.
Nice. And so just to make sure that there are still doctors who know how to take care of these patients when they come in. And fortunately, abortion is really, really safe. It's much, much safer than just continuing a pregnancy to term. That being said, there's still going to be complications. And then there are definitely going to be complications when patients are desperate and start taking matters into their own hands and start doing self-induced abortions if they can't get access to mifepristone or misoprostol. And those are the 2 drugs that make up a medication abortion. And so we are going to start a fellowship in family planning through the Department of OBGYN, but something that we're also going to do is start mini fellowships for other specialties. So emergency medicine, so that they get trained up and know what's going to come down the pike, what they're going to start to see. But one of the most important ones is nursing. I have lots and lots and lots of medical students and residents and physicians who are very, very interested and motivated to learn how to take care of patients who want an abortion. What I don't have is a lot of nurses who will openly help me. And what I don't have is, even if they will help me, they're scared of the lateral violence of the other nurses who are now going to talk about them. And so even though California is quote unquote a sanctuary state, even in California, in Orange County, you can have hospitals. One of my friends is an OBGYN, and she had a patient who had a miscarriage, and so many of the nurses misunderstood what the miscarriage was, that they could only find one nurse to help them. And hospitals are very protocol driven, that you need to have this right amount of staff in order to do those certain services. And so what we really need to do is focus on everybody. The other day, even at UCI, where I've been working and sort of working to change hearts and minds for 12, 13 years now, one of my good colleagues, Dr. Perry, had a long delay in starting her case because they couldn't find an anesthesiologist who would provide the anesthetic for a termination for a patient who had a desired pregnancy, but the baby had a lethal fetal anomaly. And they couldn't find an anesthesiologist who would take care of them. And this gets back to what Sylvia was talking about with having those courageous conversations. It is very easy to wash your hands of this and say, this isn't my problem, but this is everybody's problem. And we're going to start to see it and feel it. But especially in Orange County, it leans a little conservative with regard to this. You know, depending on when you're counting, 1 in 3 to 1 in 4 hospital beds in Orange County are run by a Catholic facility. And I can't tell you the number of times I've had patients tell me stories where they ended up in the emergency room at a Catholic facility and nobody would take care of them. And they didn't know, they didn't realize that. And when they signed up for their health plan, they didn't think to say, oh, but excuse me, is abortion covered in this? You know, because you're not going to say that when you're getting hired. And you're not going to advertise that. So, and the other issue is that even in our sanctuary state, we have abortion deserts, which I think Sylvia mentioned. We had a patient at Planned Parenthood who got on a bus and rode 3 hours with her 3 children to come and get an abortion. Her kids waited in the waiting room, and she didn't get IV medication because she needed to be able to take care of them immediately after her abortion. And she had a 12-year-old, so he could watch them, but then she had to get back on the bus and go the 3 hours back to her town. And this is in California. So we can't have enough of those courageous conversations. We can't talk about this enough because we need to move the goalposts even in California. We keep needing to move these goalposts to push them even further to support reproductive rights and choice. And so I know that we're running over time, and I think I made that really, really depressing. And I feel horrible about that. So, but what I do want to say is that we're working on an education initiative. There are tons of people who are signing up, and it's gotten attention from the powers that be in the UC system, and that's wonderful. So please have those postcard parties, talk about this with everybody, go door to door, use the all the networking that you can to start working on this. And then I just leave you with that last slide. And I thought it's one of the most powerful quotes. And oh, Cynthia, I totally just put you on the spot to find my slide. It was there. Anyway, it's a beautiful slide. It's a beautiful quote that says, women are dying, if I can do it right, women are dying not from untreatable diseases, but they're dying because as a society, we have yet to decide that their lives are worth saving. And that's what's happening. In all those states, you have to have, even when they say, okay, we'll do it for lethal, if the mother's life is in danger. I have had physicians in California, in Orange County, when my patient had a 50% risk of death, I've had physicians say, so it's not lethal, right? She's got a 50% chance of living, so it's not indicated. And so when, even in places where they say that there are indications for maternal life endangerment, it's not even close. And we have to be really, really careful and speak up a lot. Thank you so much. And I think we've all gone over, and poor Aisha.
Yeah, well, no, we're good. We'll take the time we need. Everybody's on. I'm not worried about it. I am going to take a moment of your time before I introduce Aisha. Tabby was not, you cannot see her face. And there's a reason for that. I'm sure you all know the reason, but I'm going to take a moment. My daughter, of course, works in reproductive rights, if we've mentioned before, as a, funny that the Tabby's close with my daughter. And her boss, who was a very young doctor, I'm looking at Aisha, probably around like Aisha and Tabby's age, with 2 small children, Fox News put her picture on the news and her place of work, and kind of invited some violence toward Jody. That is why Tabitha did not show her face today. And Aisha is very, courageous to be doing it. But I certainly understand why Tabby did not. But just a word of explanation in case anybody was thinking maybe something was wrong with either her computer or yours. Okay, Aisha, wrap it up for us.
Yeah, or just stupid. No, I think I will say something though. I think, like, as you mentioned, media has a huge responsibility in how this story is narrated and how people who are part of abortion care are treated. And I think they're not doing the best job. I think especially now there's a lot of race to tell this story, and a lot of our safety, nets are going to the wayside. And so I'm just risking it, I guess.
No, and you and I talked about this. Sometimes I show my face, other times I don't, and I wish I were more deliberate about it, but yeah.
Yeah. I think sometimes I'm like, well, you know what? I'm already out there. Here I am. But anyway, it's so nice to be here. I will keep it short, mostly because everyone did such a wonderful job of covering the subjects that I'm supposed to cover. But I will give you a little bit more background about myself. So I am based here in Los Angeles. My main job is working at a community clinic out here, doing full spectrum family medicine. I'm a family physician. I also contract for Planned Parenthood Los Angeles and do abortion care for them. And then I'm also the co-medical or CMO of Choice, which I'll talk more about because I think it's interesting and of course relates to this, especially with Roe being overturned. Choice is a telehealth reproductive health company, and we mostly do medication abortion, but we offer a full spectrum of reproductive health care, contraception, STI testing, different things like that we can do virtually. I'm also the medical director for TEACH, which is Training in Early Abortion for Comprehensive Healthcare. It is a nonprofit based in the Bay Area. And we facilitate training for family medicine residents up there at abortion clinics. And so mostly Planned Parenthood, but some smaller clinics as well. We, along with RAP and Planned Parenthood, have been very involved in the California Abortion Council, the future of Abortion Council. And our bill specifically that we've co-sponsored is 1918, which is to increase, basically create a core of abortion providers and have a lot of funding to not only expand training for abortion providers, but also for loan forgiveness, because it's horrible out there. But anyway, so that's more about me. Yeah, so I was asked to talk a little bit about abortion deserts in California, and I think this is why choice is so directly tied to it. As of 2017, Butte-Montclair had I think 40% of counties in California did not have an abortion clinic. And so, yes, we have a huge state. We have a lot of counties. Some counties are much bigger than other counties, but that's still a huge percentage of counties that did not have an abortion clinic. And that number is probably lower even in California at this point in time. And so there's still a huge need. And it's not even just in rural counties, which there is an incredible need there, especially, in Northern California, closer to San Diego. But also even in Los Angeles, it's not always easy to get in for an appointment. And one thing that I want to highlight that's happened post-Roe that I've been hearing from both Northern California and Southern California Planned Parenthood affiliates is seeing patients in California coming in at later gestations than they were before. And I don't think we totally understand, is this because other people from other states are coming in and there is less availability? Maybe, don't totally understand it, but it is something that seems to be a trend. So interesting, but access is a huge issue. And as Sylvia mentioned before, it's an even bigger issue, of course, for marginalized communities, people of color, under-resourced folks, transgender and gender non-conforming people. It really affects those people, and then predominantly Black women or Black people. So that's something that I think we all need to scream from the mountaintops, close to the mountains, because I think it's really important, especially when it comes to abortion care, just to say that, because I'm sure you've heard this everywhere, but if you are wealthy, you will be able to get an abortion. Yes, it will be really inconvenient and really terrible that you will have to travel and do what you need to do to get an abortion, but that access will not be taken away from you in the same way that it is for our marginalized people and our communities of color. So I just want to say that. Super depressing, right? This is a very conversation. But moving into what we do in choice in order to increase access. And there are other telehealth companies. I will say that we were the first to launch in California, which is very exciting. We're also the only asynchronous clinic out there, which means that we, for the most part, only under special circumstance, but for the most part, we actually do everything over encrypted text messages and HIPAA compliant systems. And so not over phone and not over video. And so it's a different model than a lot of the other telehealth models that are out there for providing abortion services. And part of what is so wonderful about that is it does increase access for people who maybe don't live in a place where they get the best cell phone reception, but they do have access to internet, or can't do video calls for one reason or another. If they want to keep things a bit more private, it makes it a bit easier for them. We do have not too many, but we have definitely seen a good number of transgender patients. And I think that for many of them, it is easier to just do this over text rather than over a video. And so I think there are a lot of privacy advantages, but I also think we're able to reach people in communities where it might be a little bit trickier to reach people. And I will also say that just in being a part of choice and also part of Teach, and just really in this movement at this time, it's been encouraging to see all of the resilience. And it's been nice to have so much support, like our people at RAP. Thank you, Sylvia, for helping our patients pay for these services who can't pay for them otherwise. And so I want to leave a lot of time for questions, but I do want to kind of say that there has been, I think, this hope and this fight that has always been present in this community because we've had to be like, we've had to have that. But even more so now, with Roe being overturned, a lot of people are getting together and moving in really positive directions, especially in states where we're able to do that. So I think that's it. I'll talk more with the
Thank you. That was great because nobody else is doing choice, and that telehealth is just absolutely fascinating. I know we do have a fair amount of questions and it is after 8 o'clock, but I think you explained most of it, that it's done in a new form, and it is person to person. Is that the way it works?
Yeah, so it's done. Yeah, so the way that it works is people find our website, and we advertise through Google and Plan C and other websites. And so if you're interested, you fill out a questionnaire. It's the same questionnaire that you fill out if you were going into a provider's office, your medical history and all of this stuff. It then goes to clinicians. So one thing that's also really special about our company is that we are run by advanced care practitioners, so nurse practitioners, PA, and then we also have a nurse midwife. And so as an MD, I do the consulting and reviewing of things, but I'm actually not involved in direct patient care in that same way. But once that questionnaire is reviewed, and questions might go back and forth via text to clarify things. Once that person is approved, then we mail the medication through, we use Honeybee Pharmacy, which is based here in Los Angeles, and they've been mailing medication throughout the states for the last, couple months, to mail the medication. And then we schedule follow-ups via text to check in with people to see, do they think they passed a pregnancy? What symptoms are they having? And then at around the 4-week mark, we have them take a pregnancy test at home. The majority of those are negative and the process is complete. And then there are people, where further follow-up or referral for in-person care is necessary. So
Okay, thank you. Yeah, that was great. I just wanted just a little bit more.
Yeah,
because it really was, it's a fascinating new thought. Okay, Cynthia, back to you for questions
Sure.
and answers.
Well,
And everybody was fabulous. So Cynthia, take it away.
everybody was fabulous, and that was a tremendous amount of information. And thank you all. I mean, it was really excellent. We did have some questions coming in over the course of the evening, and they seem to relate to individual speakers, and we can start that way, but others can chime in if you want to. So the first question is for Sylvia, to start at least. Under federal law, is it currently legal to mail oral abortion meds via USPS to people in states which have outlawed abortions?
I'm actually going to ask Dr. Wagner to answer that because she works on that aspect. We just
Sure.
do the funding. So I think it's more appropriate. And perhaps also talk about, I mentioned advanced provision, and I'm not sure if people understand what advanced provision is, but that's something else that we're funding. But you would be the better person to answer those questions.
Thank you, Sylvia. Thank you for reminding me, because that was something I wanted to say.
And you guys just started it. Yay.
We just launched yesterday.
Yeah.
To answer the first question, so no, unfortunately, no. And we are, as Krista mentioned, everyone is just running around trying to figure out what the laws are. It's very challenging. We have a legal team. We have multiple legal teams. And it's pretty chaotic right now. But essentially, no, we're not allowed to provide services to anyone who is in a state that is banning abortion and banning specifically medication abortion, because some states do specifically just ban medication abortion, or via telehealth, I should say. And so, there are a lot of grassroots organizations on the ground who are figuring out loopholes and ways around that. And it's really heartbreaking for us But we do, in order to protect the services that we give, we have to go by the law, or at least what we think the law is at this point. People can travel to states. People can travel to California or travel to another state, a border state, and receive our services, but they have to essentially say that they're going to be in that state when they take the medication. And then, yes, advanced provision. So at Choice, we just launched advanced provision yesterday. It is really exciting. And what that means is that we're able to provide these medications to people ahead of time in case they get pregnant and need these medications at a later point. It still applies that we need to do it in states where this is legal. So we can't send it to Texas, for example. But yeah, it's very exciting. There are a few other telehealth companies that are doing this as well, and maybe just one at this point. But this is kind of like how we're trying to legally increase access.
So who are the women typically requesting advanced provision? What kind of situation are they? Young women, college students? I'm just curious.
That's a great question. I don't know if Sylvia, you might actually know that more than I do. I'm not sure.
I think the demographics vary right now. It's a new program that we just started and we just don't have enough statistical data yet. However, as we look at the roadmap and what's happened since post-Roe, more and more people are deciding to have that medication on hand as a just in case measure. So it's really the gamut of individuals and demographics, but we also follow our mission to be able to support those that need this most in terms of funding. And when we fund the abortion pill by mail, we don't just fund the pills to be mailed, we fund the actual shipping charges as well as the telehealth medicine visit. So it comes in one funding package, so the individual doesn't have to worry about paying anything.
So kind of a follow-up question is, I think a bunch of us had read about a woman in Europe who was providing pills. Can people in a state, again, that bans abortion, get the pills from overseas still at this point? And that could be changing, right? Because the laws are changing all the time, but what's the status of that right now? Anybody?
So they can get those pills from her. I mean, she can't really be prosecuted. But and it's interesting because so far none of the bans criminalize women for having an abortion. But it's for a long time the opposition has said that they would never do that. But of course that is the direction that they are starting to go in. For sure. So if a woman is living, say, in Oklahoma and there is a ban on abortion and she gets those pills from, I think that's a Dutch woman,
Right.
and that is, she is having an illegal abortion in her state. What will happen to her is sort of an unknown. But, as Aisha was talking about, we can't, within the United States, physicians cannot be prescribing them to a woman who lives in those states.
Okay, next on the map that you showed, Sylvia, well, a bunch of us noticed that Oregon was designated as the most protective of the states. The question is, what can California do to improve our protection for people seeking care?
The ballot measure in November, Prop 1, the constitutional amendment will codify a number of things for the rest of time, hopefully. So that would be an important initiative for us to take action on.
So once again, everybody has to get out and vote. And
get out and vote.
and-
And if you are voting, also know the information about the proposition and get people together to talk about it so that people are aware that this is on the ballot and how imperative and important this measure is, this bill.
And when we talk about the 50 states, what about DC?
Oh, I'm sorry, I forgot DC. Yes.
So DC is in which category?
For
For protection?
oh, I believe right now it's okay. I'll have to check on that.
Okay.
There's a live action map that you can use through Guttmacher Institute that, because it's changing every day, people can log on and be able to click on a state and be able to see what's happening actively in each state.
Okay.
Sorry
great.
about that.
No, that's okay. And people want to know how they can volunteer with, quote, boots on the ground. We all realize that, fundraising and donations is very important, but sometimes people want to get, more directly involved. What can they do?
Well, for us, we have a volunteer application online, and I like people to be aware that volunteering for an abortion fund is a huge vetting process, usually takes 2 to 3 months. And that is because there is a lot of requirements and background checks that need to take place. So it's great to have volunteers, but also know that there needs to be some patience as we review the qualifications and the areas of interest, and being able to support that individual to have them on board with us.
Yeah, I would say that I know I've had a lot of people have reached out and have asked, and I get it. We just want to do something. We want to feel powerful in this really sort of powerless situation in a lot of ways too. And we've had people offer to drive patients from the airport or to house them in their homes, and it just like makes my heart sing when people make those offers. It's not something that as an organization there's just a lot of risk involved in that for us. So we're not able to accept really sort of that level of contribution. I know that your organization has been so gracious though about putting together the kits so that's new for us for our abortion aid program for patients coming from out of state. These kits are being put together, and so thank you. That is definitely something that is really helpful directly for our patients. And then, like I said, we have this advocacy toolkit because honestly, I mean, it really is, we have to get this right back. We absolutely have to get this right back for the entire country. We have to keep it safe in California, and we need to get it back for the rest of the country. And that is where this movement can really use the most support. And as I said, we have postcard parties and other ideas. So I encourage you to check that out.
Great. So are there any last minute questions? You can put it in the chat. Otherwise, I would like to again take the opportunity to thank all of our speakers. It was terrific. Lots of information. Thank you to Sherry for her excellent moderation, and to Deb for keeping us on track with our Zoom and everything. And now I just wanted to share a few events that are coming up in the next month or so. And what Krista said was a great lead-in for this. Because this Saturday and Sunday, you have the opportunity to help out on this project, which is putting together abortion aftercare kits. And this is our first active event as coming after this program. So if you want to volunteer between 10 and 2 in front of the JCC and help us gather supplies for kits, which we will donate to Planned Parenthood, and then they will give out to their clients. On Monday, again, a big theme of tonight's discussion was getting out the vote. On Monday at 4 o'clock at one of our members' homes, you are invited to write nonpartisan postcards to low propensity voters in other states. The RSVP for both of those events is listed here, and I think Deb just put them all in the chat. And then on Sunday, October 9th, we invite you to join us at the JCC for a welcome back gathering, which will be a celebration of NCJW and our membership and the Jewish holiday of Sukkot. So that's it. I'm ready to wrap it up unless there are some last minute comments or questions or anything else that our speakers want to share with us for thoughts as we end this session. Or Sherry, where did Sherry go?
Cynthia?
Yes,
Hi, it's Dale. I just wanted to reiterate that, the publicity was a little confusing. This weekend is for the gathering the donations. We're not putting together the kits. We're gathering donations, so we need a couple people to be near tables just to gather donations. Then a few weeks later, once we see what we have, we'll buy what we need to fill it out, and then we'll do the put together of the kits.
great. Thank you for clarifying.
It was a wonderful program.
Thank you.
Thank you all.
Thanks to everybody. Sherry, last minute. You're muted.
Sometimes I think you can even hear me when I'm muted.
Sometimes I think I can.
Yes, you wouldn't be alone in that. I'm going to stay on, Cynthia, so we can recap a little bit. But
Sure.
I knew everybody would be fabulous. They were even more than fabulous, and I'm so looking forward to individually working with each one of you in the future in something that's meaningful. And I'm just going to grab my group of my little posse here at NCJW, and we'll just show up. So thank you so much.
Well, thank you so much for inviting Planned Parenthood, and when they sent it to me, I was very excited. I said, yes, I'd love to. And I have to say that this was very organized for Zooms. I have been on so many disorganized Zoom meetings, and this was fabulous. So well done, and thank you.
Yeah.
Thank you.
everyone.
Thank you.
Excellent.
Thank you so much. Very much appreciated being here.
We'll be
Take
in
care.
touch.
Evening,
We'll
everyone.
be in touch.
Good
Bye-bye.
night.
Night.
Good night.
Tabby.